My name is Pam Schellner. I am the Executive Director for the Riverside University Health System and the Arlington campus. The Arlington campus is the behavioral health inpatient treatment facility and emergency treatment services for behavioral health. So we have capacity for 77 inpatient beds and 24 spaces for emergency services. Because of the way the facility is built, we have 28 patients on our larger units, and we don't have any private rooms, so there's 2 and 3 patients to a room. Social distancing is nearly impossible. So if we can decompress and move some patients away, we may be able to do better social distancing for these patients. We've had our patients come here either with law enforcement because they're on a legal hold, or they're voluntary and come in with family, or brought in by AMR, ambulance services. Originally, we were screening them in our triage area. Our triage area is very tiny. So with all of the issues going with the COVID crisis and everybody's escalation points with that, we opted to put a tent in our parking lot so we could screen the patients with the screening tool prior to them coming into triage. Now, whenever the patients are screening positive on that screening tool, at first we were sending them to Moreno Valley Main Campus ER. And about 3 weeks ago, we emptied our adolescent unit, so we're no longer admitting adolescent population. They're going to other facilities, and we are made that our COVID testing unit. So our patients that are potential or being ruled out for COVID are going to that unit to wait for their testing results because they're still on some type of a legal hold. In opening our unit where we're holding the tested patients, those patients are all kept in a single room because most of our patients, we don't have any single rooms on this campus. So those double patient rooms are now being used as single rooms, and we can house up to 6 patients on that unit. They're being kept in their room until their testing results are back. The nurses there and all the staff are provided full PPE. Our psychiatrist on that unit is actually seeing the patients through telemedicine. So we've set them up with an iPad, and the patient has an iPad, and they're able to see them with the assistance of the nurse and the social worker. We have taken what was previously juvenile hall and opened that up to be 20 beds and then eventually 40 beds if needed to increase our capacity for patients being tested for COVID that needed or on a hold of some kind and could not be discharged otherwise. And then with our setting up our tent in our parking lot for screening, that was to protect staff and do better screening before patients come into the building. So we could make a decision, because the patients who are screening positive now are not coming in through emergency services and triage. They're being taken directly to the unit where we're doing COVID testing. Dr. Chang and I were on a call for California Hospital Association a couple of weeks ago, and they were asking what different facilities were doing and how they were treating their potential COVID population. And what they're doing is sending them to a medical hospital to be kept and wait for test results. We're doing that here on our site. Whenever we told them that on the phone call, it was dead silence on the phone call because no one else is doing it. So far, to date, we haven't had any patients test positive, which is very good, but I know it's probably a matter of time before we have one.